Hi, Dr. Deneen here, and in this video I want to go over a concept called cycle mapping. Now this is going to apply to you whether you are in your fertile years, whether you're having a regular period, an irregular period, are perimenopausal, or are menopausal. So just listen to this video so you can understand the concept of cycle mapping, and then we're going to see how it can best apply to you if you were in any one of those other categories with an irregular or an absent period. So cycle mapping is actually a way that we can map out what phase of the menstrual cycle we're in. And that will give you clarity on exactly what your hormones are doing, what they're supposed to be doing, and how you can support them. Now, in order to cycle map, you either have to have known when your last menstrual period was, the date, and you're going to want to start on that very date and count 14 days into the future, 21 days into the future, and about 28 to 35 days into the future, depending on what it is for you, is a normal menstrual cycle. Now, if you don't know when your last menstrual period was, then you're going to be able to really clearly start cycle mapping once you determine that date. Now, if you know when your last menstrual period was and you get out a calendar and you look and you see, you're going to find that you're somewhere on this continuum. You might say, oh, yes, I'm on day 10, or I'm on day 21, or I'm on day 14. Those are going to be the conversation that you're going to be able to have with yourself about what your body inherently wants to be doing. Now, if you're not having an active period and you are irregular, and you haven't had a period because you're either getting off the birth control pill or you're just having irregular cycles, in my clinical practice, I just put you in the category of being in the phase 4, or what we know is called the luteal phase, which is premenstrual. And we're going to work within that context to help get the period initiated. And then once it starts, we're going to be able to cycle map. Let me tell you a little bit about what a perfect period looks like and a perfect menstrual cycle. A perfect menstrual cycle, in the beginning, the bleeding is between 1 and 5 days. It actually should be closer to 3 or 4 days. And the blood should be red, not purple or dark or clotted, or it shouldn't be too painful. And it definitely shouldn't be trickling and brown when the period stops for several days after. All that kind of means something. But in a perfect period, it's about 1 to 5 days, and when it ends, up until ovulation, this is generally a time when women feel really good. They feel really clear, their skin looks good, they have more energy, they generally feel like they're kind of on top of the world again. The menstrual cycle is an opportunity for cleansing. I call it the inner winter. During the winter, we want to hibernate and rest and stay warm and drink tea and just reserve our energy. And that's how we should be treating ourselves during the menstrual cycle. We should be letting the blood flow, and we should basically be going into our red tents and letting ourselves regroup and release. The theme of the menstrual cycle is releasing. After the menstrual cycle, we're moving towards a new phase where we're going to be actually having to make a large energetic deposit with the release of an egg. And that takes a lot of energy. In fact, that whole process of getting that egg prepared starts on day 3, and it's called the follicular phase. And that's when the ovary is then being ripened for the next phase of her work, which is to release the egg. During ovulation, we'll see a spike in testosterone, and that usually coincides with a little more increase in creativity, energy, sex drive, and inspiration. This phase is then going to determine what goes on in the 4th phase. If a pregnancy occurs and there's conception, the hormone progesterone starts going up for the next 12 weeks. If it doesn't occur that month, progesterone will reach a little peak around day 21, 22, 23, and then it will start to go down once the body sends the messages that there's no conception that month. This phase is known as the luteal phase. And in some conversations, women also call it the premenstrual phase. Now, the reason this phase is sometimes wrought with a little bit of emotional or physical symptoms that aren't so pleasant is because there's a a surge in hormones and then a drop. And it's also a time when, if there's any kind of latent deficiency, nutritional, mineral, or vitamin, or there's a little congestion in the detoxification pathways, this is when it's going to show up in the body, where women are going to have breakouts, they're going to feel tired, they're going to feel bloated, they're just going to generally have lower energy. And this is sort of an indicator of the health of the liver and the detoxification pathways. So how do we get this all organized, and how do we map this out? Essentially, we want to divide our period into two halves, our period month. Now that could happen for you anytime within a lunar cycle. And I'm going to go back to that when we talk about menopause. But essentially, from bleeding until ovulation, you're in a follicular phase and you really want to nourish. You want to build. You want to juicify. You want to tonify. And you want to give your body what it needs in order to have the building blocks of the estrogens and the testosterone that it's going to rely on in the latter phases. And there are two seeds that I love to suggest for women to integrate into their diet every day, and those are flax seeds and pumpkin seeds. And this is called seed cycling. And you can look it up and you can find out why. It's because the actual fatty acids in these seeds are the ones that nourish the estrogen. So if you want to support estrogen naturally, if you're menopausal, you want to integrate these seeds into your diet. You want to integrate these oils into your diet. You want to have these things. Another thing that's nice for women at this time of the month is called maca. Maca is very tonifying, and it's nourishing, and it also helps to build somewhat of a little more testosterone, so it makes it perfect to take in this phase of your period when we're trying to almost gather the energy of testosterone and estrogen and testosterone. See? The next phase is the luteal phase, and this is the phase where we want to cleanse more and clear. We want to support the liver. We want to do more detoxification at this phase. We also want to support the hormone progesterone. If you're menopausal, this is when you want to use your progesterone. We don't want to take progesterone every day. We didn't ever do that when we were naturally cycling. So we want to layer in what our body would normally have expected, and that is having a balance. So in this phase, called the luteal phase, around day 19 to the menstrual cycle, this is when we want to support progesterone, and the seeds for progesterone support are going to be sunflower and sesame. And I love sesame seed paste, and it's called tahini. So I usually make a tahini dressing at this time of the phase of my month, and at this phase of my month I use pumpkin seeds and flax oil on my salads. This phase of the month I do my tahini dressing and my sunflower seeds, and it really beautifully keeps my hormones in check, and it's very effortless. It's just about lining up where you are in the month to what you're going to nourish and support, because you may have been told you have a progesterone deficiency. Maybe you have a progesterone deficiency. Maybe you had one at one specific window of your life. Maybe you have a progesterone insufficiency, but you really want to adjust it, work on it, support it at this phase of your month, not in this phase. That's one of the biggest mistakes I see women making. They say, I need to support my progesterone, but they're doing it at the wrong time of the month. I had my progesterone tested. They got it tested at the wrong time of the month. That loops into testing. We don't want to test our progesterone at the wrong time of the month because it's not going to be an accurate reading, and we don't want to base anything off of that. We don't want to base there being something wrong when there in fact may not be. That's a huge thing that I notice in women's health. Women do not have the issue that they have. I never take a diagnosis from someone unless it is completely accurate. And I double check that for myself, because women will come to me and say, my doctor told me I had this, and in fact, they don't have that at all. Nor does their child. We need to be accurate when we're making diagnostic tests and we're making any assumptions based on those tests. We need to make sure we do the testing at the right time. So this is called cycle mapping. How this can be applied if you are in menopause is twofold. Some women tell me who are in menopause, which officially is not official until a woman has had no menstrual cycle for 1 year. Some women have told me, I feel a natural rhythm to my hormones every month, even though I'm not having a menstrual cycle. Half of the month I feel like I'm in PMS, and the other half of the month I feel like I feel really good. So they have this in tune, innate understanding about where they feel they have a pattern in their month. Some women will keep in rhythm with the moon. Now, I personally, in this map, in my 7-year cycle, I'm 47, so I am not in menopause. I do not personally know for a fact how I feel in that phase, and I like to speak about things that I've generally experienced. But what is working for a lot of women in menopause is to cycle map their hormones. So they say one half of the month they balance their estrogen and nourish their estrogen, the other half they're doing their progesterone, and they're doing it in alignment with the moon. The moon in the sky, the reason I asked you to pay attention to her during this 6-week transformation, is your own app for your cycle. Now, for instance, when women are in their fertile years, sometimes it may be more of a pattern for them to ovulate around the full moon and have their period around the new moon. As women move towards menopause, they might start flip their pattern where they're getting ovulation on the new moon and they're having their periods on the full moon. There's different theories about that, but using the moon to cycle map and line up your strategy for the month, whether you're going to build or you're going to clear, is another way you can get in alignment with these invisible cycles that are always constantly underneath the surface that govern our hormones. So we are moving in always one phase or another in the moon. At the time of making this video, I know that the new moon is going to be beginning on Friday, January 20th, and that offers an opportunity for a new cycle, a new phase, just like a menstrual cycle offers a new phase and a new cycle. One other little piece of wisdom about the menstrual cycle is that the menstrual cycle, post-bleeding, ovulation, and premenses all follow the same rhythm of the outside harmony of the seasons. So if you really want to stay in balance with your cycle, you want to think of each phase of your cycle as a season. So in the winter, you want to hibernate and rest. In this season, like the spring, you want to plant seeds and lay a foundation for all your hormones. In this phase, you really want to warm and nourish and activate your hormones with very powerful superfoods. And then in this phase, which would be the autumn or the harvest, you kind of want to clear and let go of and cleanse and release anything that doesn't work for you. If you work with these cycles and you stay in alignment with them, you're going to see there's so much more momentum for you to accomplish your goals of being in balance with yourself, body, mind, and spirit. And who doesn't want more of that? So again, this is Dr. Deneen Pachano, acupuncture physician, and you are a whole person and you deserve a whole person approach to healing. And I thank you for watching this video on cycle mapping. See you around.